Hello, Cumberland Valley families. I wanted to provide an update for everybody on how things are going at Cumberland Valley and what we're doing to try and improve the educational process for students using our three models that we have going on right now at the elementary school, the middle school, and the high school. So first, I did want to talk about the fact that we did have our first exposure in a Cumberland Valley building. It's the first time that we've had a student who is either symptomatic and then tested positive, or a student in this case who was asymptomatic and tested positive, who'd been in a Cumberland Valley school within 48 hours of that test, testing positive. So this is the first time that we've actually had an exposure, which is really amazing when you consider the fact we have so many students who are attending school face-to-face here at CV. We have more students attending school face-to-face here, even though, you know, in the hybrid schedule, they're not here every day, than just about anywhere. And so for us to not have our first exposure until after we gotten through 8 weeks of school is pretty remarkable and says a lot about the community and the work that everyone's been trying to do. I think it's really unlikely that, you know, that we're going to go a long time without another exposure, unfortunately. Community spread right now in Pennsylvania is high, and it's even higher here in Cumberland County than it is in Pennsylvania. So we really appreciate everyone's support. We appreciate people not sending students to school when they're symptomatic. You know, if there is an exposure, you know, making sure that we're aware of it. In this situation, there really wasn't anything anybody could do. It's an asymptomatic student who tested positive after being in school. And so then we have to move through and we do contact tracing. We identify who the individuals are, you know, who potentially could have been exposed. We think it's unlikely that anyone's going to get infected because of what we're doing at school with masking, with distancing, all those kinds of things. But we still follow protocols, and anybody who was within 6 feet for 15 minutes, we're asking to stay home for 14 days. We're actually requiring them to stay home as per the Department of Health. So in this scenario, you know, we're going to have students who have to stay home because there was an exposure at school. But we're not closing buildings. We're not, you know, we're not stopping our educational process. You know, I think when you look at what the disruption is from an exposure versus what it could be, it's pretty substantial, and what we're putting in place is working. So I want to just take a moment and explain kind of a graphic. This graphic's from the Cleveland Clinic. I actually got it from the Children's Hospital of Philadelphia's guidance on in-person schooling document that I have linked below here. I think it does a great job of explaining, you know, the goal for not having transmission at school. So even if there is an exposure at school, the goal is that no one would get COVID-19. Now, unfortunately, we're not able to fully manage 6 feet of distancing in all of our spaces. So we have had to quarantine some students at this time. And we are, you know, obviously very hopeful that none of them get sick and that there was not a transmission at school. But we have stacked a bunch of other options together. We're very close to 6 feet. So even though we're not reaching 6 feet, so we have to do a quarantine, we do believe that we've been able to really mitigate the potential that anyone gets infected or gets sick. So that really is our goal. And it really should protect the entire building to some extent because we're following these protocols. But those protocols, you can't do them with a full building. You have to have some space. You have to be able to manage all these other things that we're doing right now. So once again, like I said, this I think does a great job of explaining how all of these things work together to support an environment that even if there is an exposure to COVID-19, hopefully will not result in a transmission of COVID-19 in schools. So rates right now in Pennsylvania, they are going the wrong way. There's no doubt about it. Cumberland County right now, this is our rates. So, you know, when we started school, we were in the 20s in terms of incidents per 100,000. We're at 69.2 this week. Our incident rate has been as low as 2.5. This week it was 6.6, the percentage positivity rate. So if we look at the incident rate and the positivity rate right now, they are definitely heading the wrong direction. If we look at them historically, so since the beginning of this tracking, since July 31st, when we started keeping track of this here in the district office, this is by far the highest PCR positivity rate that we've seen, and is actually considerably higher than even what's going on in Pennsylvania generally right now. If we look at the incident rate, right now we're above Pennsylvania as well, and Pennsylvania is one of the highest rates it's been. Actually, it's the highest rate it's had in the state since July 31st. So everything's heading the wrong direction. And so as a community, we really have to try and get this down by following protocols, by wearing masks, by physically distancing. All that stuff has got to come back into fashion, I think, for us right now. It's really important because otherwise this number is going to continue to climb. And that has a big impact on what we're able to do instructionally. So right now, the instructional models we have either use cohorting, like we're doing at the elementary school, where students are really not exposed to more than 20 students a day. They're in that same group all day long, or what we're doing at the middle school and the high schools, which are those hybrid models. So that is what the recommendation is right now for us as we're in this moderate community spread situation where, you know, right now we're at 6 6.6 here, the PCR positivity rate, and the incidence rate right now is right around 70. So for us to come back to face-to-face, I'm going to talk about this a little bit later, we need to get that down. We want to see 10 incidents per 100,000, not 70 incidents. And we want to see a PCR rate that's below 5, which we've been below 5 on a pretty regular basis. But now that we have so much robust testing, we would anticipate that we are below 5 because there's a lot of testing being done, but we're not right now. You know, unfortunately, we're headed this direction, which is substantial community spread. Right now, the trend line is not great. So I will talk a little bit about what we will do if we end up in substantial spread, as the trend line looks like we will if we don't have a correction. But right now, I think we were going to stay the course with our current model. So these are the models I just discussed: the elementary, the middle school, and the high school. Obviously, the high school is more restrictive. Students are only here 2 half-days for face-to-face instruction. Their other live instruction is via Zoom. And we know that certainly is not ideal for students. We're aware of that. And we're trying to identify ways to improve that for kids. So, you know, they're doing a good job. The cohort model, if an individual exposes students at the elementary school, we have an exposure, it's just the cohort that would be out right now. So that whole cohort would likely be out, that class of 15 to 20 students, but it would not be the whole school because we kept them separated, and that's a very effective model. At the middle school, we really have mitigated spread and mitigated disruption by going AA off BB. So we've had students test positive at the middle level, but this is the first time that anyone was in school within 48 hours of testing positive or within 48 hours of becoming symptomatic. So that model is working well. We would have had cases. Had we gone AB off AB or AB Friday off, we'd have had incidents prior to this that caused exposure. This is the first time, though, in our current model that we've seen that. So it has worked well so far. At the high school, as I said, we know it's not ideal, but it also allows us to integrate the virtual academy, which was just so necessary. All the students are fully virtual into the high school schedule. Without doing what we're doing right now, we just would not have been able to do that in any way. The only other way to do that would be to be fully remote, where you could have kept the kids in the virtual academy. So we're still able to offer some face-to-face time for students to get them onto campus. We know it's not ideal. We're trying to identify ways to improve that for our kids. I'm going to talk about that a little bit as well. So what's going to happen? Let's say that we keep going up and we end up over 100 incidents per 100,000, or the PCR rate goes over 10. Well, you know, we don't see that as a bright line. We don't say you have to go immediately to, you know, fully virtual instruction. We think what we're doing is really mitigating transmission in our buildings, is having a very strong effect of really reducing the ability for, even if somebody is exposed, for them to get COVID-19. You know, based on that graphic that I showed you from the Cleveland Clinic, we have a lot of things in place to support students. You know, they are fairly well spread out. We have good ventilation. We've reduced the number of kids in buildings. We think that right now what we're doing really should mitigate transmission. There should be a lot of transmission in schools, even if there's an exposure. So, you know, we're going to keep an eye on those numbers, obviously, but we don't see them as a bright line test. And so right now the plan is, even if we would go into substantial spread numbers, we would stay the course and we would stay in school. That would be our plan for now. Obviously, things that could really have a big effect on that, if we have too many staff members who've been exposed to COVID-19, even if they're not going to get it, but they are within that 6 feet for 15 minutes and we can't open the building, that would be something that would close us. I mean, I think also if we saw that any evidence of spread, that we saw transmission at school, those kinds of things, that would be something that would cause us to really think about going to a fully remote option. But right now we haven't seen those things. So the flip side of that, what would cause us to bring more kids back, to get back to face-to-face instruction, get back to some sort of normalcy? We got to get our numbers way down. I mean, we're at 70 incidents per 100,000 right now. That needs to be at 10 for a sustained amount of time or lower. So, you know, really a seventh of the transmission we're currently seeing in the region, and we're heading in the wrong direction. Also, we'd like to see that PCR positivity rate lower than it is. We'd love to see that, you know, well under 5 and just not a lot of incidents for us to start bringing kids back. If we bring students back right now at the middle school and the high school, we're going to be a lot closer than 6 feet. We're going to have students at 2 feet. You know, and so one incident, one student, you know, could affect 100 students in a classroom. It would cause us to have building closures that I think would be more disruptive than what we're doing right now with this schedule. So, you know, we need to see a much better trend line for a while before we would consider bringing kids back to face-to-face in large numbers. I'm hopeful that will occur. I'm hopeful we're able to get these numbers down. Having said that, we know that this model is not working for all students, and we know that we've heard from parents say that my student is just not being successful here. So we're trying to put some things in place. We had a really large, update to Schoology. We've tried to standardize it. We've tried to ensure that individuals, every student can find the information they need, their family can find what they need, that we can work through that, and that it looks the same from teacher to teacher as much as possible. The other thing that we've heard is that some students who are struggling just are not attending. They're not in the Zoom classroom on those days when we're supposed to be doing live instruction via Zoom. That's school. We really need kids to be there. And I think if they're not there, is a real challenge for us to be effective. They're not going to be effective in this environment if they're not participating. So we really implore people to really check in with your kids, make sure that they're doing that. If all those things are in place and your child is still struggling, is it in a class? Can we talk to an individual teacher? Can you email the teacher and ask them for support, or is it a global challenge right now? The child is just not doing well. Your child's just not doing well in any classes. We are putting interventions in place. We have asked our principals to try and identify what those interventions are, how they can help support students. We would ask you to reach out and say, my child, this just is not working. They're doing everything they can do and it just isn't working. Okay, let's see what we can do to try and support them, because we want everyone to be successful. That is our goal, absolutely. We're all in this together. I definitely feel that way. I'm so thankful to be here in this community with these awesome people. You've just been wonderful. We just have such a supportive community, and it really is important. Our teachers are working like crazy. I know you all know that. Our administrators are working like crazy. I think, unfortunately, right now with the trend line, we are going to have more exposure. There are going to be more situations where we're calling people and saying, hey, you need to quarantine. You were potentially exposed. And we're going to see some disruption. But it is not going to be the disruption we would have if we have lots of building closures, because we had lots of exposure, hopefully. That is the goal. We are really hopeful that the things we have in place are going to continue to work even as the cases climb and the incidents climb. But our goal has got to be, as a community, to really stay the course and to get those incidents down so we can get kids back to more face-to-face instruction. That's got to be everyone's goal here in this scenario. Thank you so much for everything you're doing to make this work. We know it's a challenge. It's a difficult time. We understand that. And we're working like crazy to try and make it valuable for students and try and keep everyone safe. I'll see you in the air. We are the Eagles of Cumberland Valley. Let's not ever forget that. CV is a strong place together, and together we're going to make it. Thank you.